So we'll be seeing the relation between food and colorectal cancers. So doctor, how can food cause or how can food prevent the occurrence of colorectal cancer? The answer is, see, whatever we take, ultimately it stays in intestine for some time and stays for a longer period in large intestine. Like when we take, it passes through the food pipe within fraction of seconds or minute, stays in stomach for say 2 to 3 hours in a normal stomach. Small intestine, it goes off very fast, like within 3 to 6 hours, but in large intestine it can stay between 6 to 18 hours. So whatever you are going to take, it is in contact with large intestine for a longer period. So if we take certain food materials, say red meat, processed meat or frozen meat, which are present there like for very long period, few can turn into carcinogens. So carcinogens are those which are prone to cause cancers. Like not all the meat, only one component of the meat can turn into a small portion which can stimulate the formation of cancer tissues. How can this be avoided? So reduce your processed food, processed meat intake, red meat intake, and avoid taking food which have been preserved for a very long period of time. In addition to that, what should be done? We have to take lots of fibers. So where do we get fibers? We get fibers in greens, green leafy vegetables and fruits. So this has to be taken even those days when we take lots of non-vegetarian. So most commonly, like most of my patients say that, so the day when I take non-vegetarian, subsequently I develop constipation. So why we develop constipation? Because meat doesn't have fibers. Fibers are present only in green leafy vegetables and fruits. So what does these fibers do? Fibers accumulate water. So in large intestine, it prevents absorption of excess of water into the body, so that some water is present within the intestine itself. So this amount of water is necessary to keep the stool soft. If excess water is getting absorbed, then the stool becomes hard, less quantity, then one will start developing constipation or presence of stools in large intestine for a very long period of time. So whenever you consume non-vegetarian diet, also do consume lots of fruits and vegetables along with that. So reduced processed meat, red meat, preserved food material and excessive intake of green leafy vegetables and fruits and other fibers definitely is going to improve your large intestinal health. In terms, it will avoid constipation, it will help in passing routine motion, it will reduce the time of any carcinogens to be in contact with the large intestine. See, this is how our food is related to development of cancers. So have healthy lifestyle, have healthy foods, avoid cancer. Prevention is always better than cure. Thank you.